Hi everyone, my name is Feather Talia, and this is my co-host.
Hi, I'm Good Medicine.
So today's topic is STIs.
Well, I'm glad you mentioned that, Feather. In fact, the verbiage has changed, and it's in fact STBBIs, which stands for Sexually Transmitted and Bloodborne Infection. And the reason that it has changed is actually because it's a more inclusive term. So sexually transmitted infections can actually range, and there's a lot of them, which we're going to talk about today, aren't we, Feather?
Thank you so much for correcting me, Good Medicine.
We're here to learn. So, Feather, let's talk STBBIs.
There's so many out there, but we'll talk about some of the common ones, like HPV.
Genital herpes.
There's gonorrhea and chlamydia.
Syphilis.
Hepatitis.
And of course, HIV. Now, we're going to talk about what we should be on the lookout in terms of STBBIs.
There's an unusual discharge from vagina, penis, or anus.
That's true. You can also feel a pain when you're peeing, and it can be quite acute and very sensitive, or it might sort of linger.
There's lumps or skin growth on your booty.
Booty. I didn't know that. That's so good to know. I've also heard you can have a rash, and it can even be on places like your hands for things like syphilis. As well, any sort of itchy, even if there's no bumps, if you're starting to itch in your genitals or your behind, definitely check it out.
Also, while you're checking that out, check yourself out for blisters or sores.
Or warts. It's important to know your body and to stay up to date with what's going on down there.
Thank you, Good Medicine, for that. It is important to get tested every 3 to 6 months.
Yes, regular testing is so important, but it can be really daunting to say, I'm having sex and I want to get tested. But it shouldn't be that scary. There are a lot of people who care about your health and wellness. For example, you can go to a parent or an auntie or even a friend's parent or auntie, and maybe you don't feel comfortable doing that with someone in your own family, but you can go to lots of different resources. For example, you could seek out resources from First Nations Health Authority or other community organizations that might have youth wellness clinics. You can also do a quick Google search and look for youth testing or a youth nurse that might be able to help you out. It's really important that we normalize talking about STBBIs and getting tested. And Feather, I'm so excited to welcome our next guest, Vida, a sexual health outreach worker, to answer some of our questions.
Thank you so much, Vida, for being here. We really appreciate you and your knowledge.
Well, you're welcome, Feather. I'm really happy to be here.
So some questions I have. So how often should you get tested?
Well, it's really important, especially if you're sexually active, to get tested every 3 to 6 months. Well, they take 3 to 4 vials of blood, and sometimes they'll do a swab of your booty, and that's okay. And occasionally they'll even test your pee. And just so you know, you can do the swabs and the pee on your own.
If I get tested, who do I tell?
Whoever you want. You're in control. So that means that no healthcare professional will disclose your information or test results.
Thank you so much, Vida, for that. I do have one more question. Why is it important to get tested?
Well, it's important because it's self-care, and you gotta protect your partner and protect your community.
Thank you so much for tuning in. Again, I am Feather Talia, and remember, snag, slay, and stay safe.